So one of the questions we've been talking about earlier is technology, and I'd like to ask each of you, what's the best way you have leveraged a technology, whether it's a strategy around a technology or a particular technology that you've actually deployed? April.
Okay,
Sorry.
I can definitely speak to this question. So we're capitalizing on, I think, more than two, but two main big technology innovations that have happened. So the first is AI, specifically in something called personalized medicine, also known as precision medicine. We call it precision mental health care. And so it's the idea that we can start to use data from EHRs, from clinical trials, from pharma trials, or whatever. We can piece together all of this data, combine it, and use that data, which has now newly become available, digital data, I mean. We could use that data to create predictive models that can start to even outperform clinicians in making the best, most accurate recommendations for individuals. So this is a whole movement. Because there is such a high failure rate across all areas of medicine, but especially in mental health care, we're taking advantage of that movement. We're actually the leaders in precision mental health care today. We've published across the top medical journals out there. We've published over 30 papers in peer-reviewed journals like JAMA or Lancet Psychiatry. We've been endorsed by the American Psychiatric Association. So in that area, we're really leading the way, and what we're hoping is that this approach can lead to much better outcomes, faster recovery times, and ultimately lower spend on healthcare. The second part that we are kind of more, accidentally using as a trend is the telemedicine movement, right? So there's a huge lack of psychiatrists and mental health clinicians nationally, globally. And something that's helping to increase the supply of these providers is not only the digital automated tools, but also by starting to use providers across state lines through telemedicine. So instead of going, an hour out to see a provider in person and then, wasting half of your day out of work to go see this person, you can just take 50 minutes out of your lunch break to see someone virtually. That's something that we kind of just naturally fell into. It just made sense for me in designing the most seamless, best mental health care experience. And so those are kind of like the two big trends that we're working with today.
Shiv, what about osmosis and technology? Where are you really seeing driving value by your investments in that area?
Yeah, I think there hasn't been that much innovation, I think, in health education technology. If you've heard of the concept of ad retargeting, you basically know what that is, where you say you're Googling for a pair of pants, and you log into Facebook later that day, you'll see an ad for a pair of pants. Now, if you have an Alexa at home, you'll probably start seeing ads for what you're talking about. We use that same kind of concept of basically trying to be top of mind for the learner, in our case, not the buyer, where we know at hundreds of institutions that are training clinicians around the world what exactly students are learning and when. So again, at University of Arizona, which is another school we work with, we know that a third-year medical student saw a patient with cystic fibrosis today, or a first-year medical student at UCSF had a lecture on thrombosis. And because we start integrating those data sources based on their curriculum, based on their patient logs, we can then start precision targeting them with education. And again, when things change, because things will inevitably change in the treatment and management of, say, thrombosis, we know that when that person last reviewed that content, so we can re-ping them with the update and or remind them of the guideline. So that's mainly how we use technology, is to, we call it educational retargeting, like ad retargeting.
You're leading your company, you face lots of challenges, you've all moved your businesses forward. What would you say was the best decision you ever made to grow the business? Matt, best decision.
Well, I think it's twofold. One, I think the remote model. I mean, I think people can appreciate that now, but when I started the company 12 years ago, it wasn't like there was FiOS and there wasn't cable modems, right? So it was a lot of struggle in the beginning. But again, with the given market, you're not able to scale if you don't have that ability to do the remote model. So as an example, we've hired 30 people this year. We hired 80 people last year. And getting those people onboarded and all those things in all these different areas, you really have to have the infrastructure in place and have that philosophy. Our philosophy has always been that work is something you do, not something you go to. So it's really a big benefit. And then the second thing, I think our focus on the science is really important. I mean, to have that kind of scientific staff, it's larger than most medcoms, right? We have over 80 scientists. Most medcoms aren't 80 people, right? So that's very compelling when we're talking to our customers.
Just so everyone understands, what's a typical medcom? How many MDs or PhDs or PharmDs would they have on staff?
Well, that's hard to say because there's no typical, but there's a lot of freelancing that goes on. So my people are all full-time. We have freelancers in addition to that, but it's not anywhere near that.
So this is a panel about what's driving value. And when you think about your business today, what would you see are the key drivers that really add value? So this is an M&A group of people who are all thinking about M&A in many ways. If you think about the value of your business and a multiple for your business, when you're leading the business and you're making decisions, what really do you think drives value to your business today? Why don't we start with JD, because you're a private equity guy as well as a manager of portfolio.
Scale. At least in this particular business, the scale really drives a lot of value. You're able to invest more in technology. You're able to provide those kind of digital automation, AI tools to really drive scale. So I think just in this specific business, the bigger we get, the more incremental cash flow we're gonna generate, and the better service that we can provide to our customer.
Okay, and then April and Shiv, you all are earlier stage businesses and are dealing with potential outside investors more actively. What do you think in terms of driving value? Shiv, why don't you go first?
Yeah, I mean, I think one reason we've been able to attract a great investor base, so Greycroft's an investor, and specifically Alan Patrikoff is a guy who's been advising us, is subscription revenue. So a lot of health education companies and education, media companies obviously are sponsored and advertising. We have direct user subscriptions and want to continue that into practice. And so being able to have a healthy revenue stream where you can add, go from a couple thousand subscribers to a couple 10,000 to a couple 100,000 subscribers, sort of like the Netflix model. And we say that when we left med school, the first article we wrote for the Annals of Internal Medicine was, what can medical education learn from Facebook and Netflix? And one of the things is, for low-cost subscription, we're able to keep these users on our platform for longer. And we can still open up advertising and still get sponsorship revenue, but I think it's easier to go from subscription to advertising and sponsorship than the other way around, where people expect your content to be free.